The agenda today, we're going to start out talking about the women's shelter, and Amanda Myers is here to speak about that. Then the corrections is going to come up and talk about some of the moves that they've got. And then Stephanie is going to talk about some of the guidance coming out from CDC on masks. So, Mr. Manager, do you have anything else?
No, Chairman, you covered it. We'll go ahead and start with Amanda, if that's okay.
Very good. Well, welcome, Amanda.
Again, thank you.
We're going to start from the top.
You want me to start from the top? Okay.
Thank you.
I apologize that you all have to hear this all over. Commissioner Cruz, can you hear me okay?
Yes.
So as I mentioned before, I'm Amanda Myers. I'm here on behalf of the Wichita Family Crisis Center. I'm clicking all. Thank you. Is it okay if I just, Nicole is going to be helping me. Thank you. So our mission is to provide services, shelter, advocacy for survivors of domestic violence and human trafficking. Often people think that our services, sort of end with shelter and start with shelter, crisis shelter. Our goal is that victims heal, recover, address all the issues surrounding their abuse, and re-enter our community as independent and I didn't mention this last time, but we've done a lot of studying about this community. Seems particularly prone to domestic violence and human trafficking. A lot of studying as part of this capital campaign in terms of what is actually making a difference generationally with the level of violence that we're seeing. So part of this capital campaign that we're about really changing the landscape of this level of violence. So, and part of that is our prevention programming, which is unique to this community at least, and as far as we know. And as I mentioned before, we started in 1907 as a YWCA. We've been in the community for 150 years. You're going to get my little color now. We were the first organization to, it was a boarding house for women, and we were the first restaurant to allow Black people. That was the 1940s. And we also had a program with 2 white women would accompany 2 Black to eating. I'm really proud of. We opened the first domestic violence. We're a long-standing community member. Community partnerships are very important. As I mentioned before, mental health is, there's a crisis in this community. I'm really grateful that the county and this commission is looking at this issue. We are affected by it on a daily basis. We have staff that are out in our parking lot dealing with people in crisis, whether they are abusers, just members off the street, our clients. It's an issue, and I think you can't look at mental health without addressing how domestic violence is both causing mental health crises and also the result of mental health issues and the issues in this community. So we partner with ComCare, we work with them, but ComCare has its limits, and that's part of what we are addressing with our campaign, is the limitations that they're seeing with ComCare. So these are just some statistics. The increases that we've seen, we talk to law enforcement regularly, we partnership with them, both the police and the sheriff's department, as well as the DA's office, and they're increasing numbers as well. You can take a look and answer any questions. So back to what I was saying earlier, there are only 2 safe, confidential domestic violence shelters in Wichita. The other one is Catholic Charities Harbor House. Between the 2 of us, we only have 60 safe beds. Again, that's only 60 safe beds for a community that's over 500,000 people. That number. And so we lack capacity between the 2 of us for 40 to 50 clients a month. We never turn anyone away. We spend hundreds of thousands of dollars housing people in hotels throughout the community, which again just makes the situation worse. It is not the kind of place where you want to be helping someone through the biggest while they're stuck with their kids in a hotel. Not ideal, and we've been recognizing that issue along with our community partners for. So these are some images of our current shelter. It's a former doctor's office. It's 55 years old. We just got the air conditioning fixed. It's hole, in the ceiling of our basement that sort of leads outside, that's always flooding, and we're kind of just switching around. There are several lights that just don't work with the humidity, office being one of them. The, top picture is a picture of our kitchen. As you can imagine, that's a really small space for 20 people to use that. It's communal living, there's only 2 bathrooms. The clients are in patient rooms, they're very, very small rooms. Even before the pandemic, it lacked a certain amount of dignity, which lacked space. Clients work with their advocates one-on-one as part of this process in their lives, and the picture on the bottom is that space. It's just overrun with donations and program supplies and client assistance needs, and it's just not an ideal space to kind of do the work that we need to do in this community. So here's where we are. Like I said before, we have raised about $6.5 million towards an $8 million goal, and that has been done in the past year and a half. Is that right? And there's a breakdown of what we've just got a huge amount of community support. The city's been incredibly supportive of this issue. There's some, I mean, we've had just support from amazing foundations who are incredibly philanthropic in this community, but also, you know, just throughout Kansas and outside of Kansas, we have really gotten traction. So we have a Maybe Foundation challenge grant right now, which is to bring Maybe into this community. It's an Oklahoma-based foundation. It's just really important because they recognize the importance of what we're doing and the need in Wichita. So we're very proud of that. This is the expected outcomes from our new facility. So I think what I wanted to focus on, in addition to obviously tripling our capacity, and we can increase that even more if we need to, the facility that we're renovating is a former hotel, so every room will have its own bathroom. But more, perhaps not more importantly, but significantly, we are part of the team. So we work directly with law enforcement. We have a lethality hotline that is exclusively for law enforcement. So that means that if somebody's their life is in danger as a result of domestic violence, the police or the sheriff's office are calling us directly. So as much as you need 911 or EMS or anything else, there is literally nowhere else for these people to go. I'll say that again, nowhere else. If you're talking about a process of getting victims safe, you're integral to that process. We're not there for entertainment, we're not the arts, we're not education, we are life-saving. Wait, can you go back? Thank you. And so what we are able to do with our new facility, which we can't do now, is have a meeting spaces. So we have a space where clients can get those forensic exams, and now they're going all over the city to get after their rapes. And sorry to be graphic, but that's what it looks like. Or we have the DA or the prosecutors coming to our place to interview witnesses versus us taking, one end to get them back and forth to appointments. This is efficiency, and I just need to, again, emphasize the fact that we're already working closely. We have 2 advocates that are in the county courthouse right now. They actually may be in a different round, but they are working with the DA, with Mark Bennett, with Shannon Wilson, with the attorneys that are prosecuting these crimes, helping the victims through this process. Also, we have an advocate that's helping them. So if somebody's going to get a restraining order, they're talking to our advocates about how to go through that process. So I just wanted to emphasize how far we are taking these community partnerships and how important they are. Okay, and also I just want to emphasize with our new facility also, as an aside, that is my son and my dog in the picture. They were there for a volunteer day, so it just gave me a sense of joy to have my son and dog in a picture. So again, it's kind of, I was saying before, as part of this capital campaign, we've studied what it means in this community. We are just sick of putting a Band-Aid, drinking out of a fire hose, whatever analogy you want to use. It is time to address the predicates of this issue. And we work with groups like Rise Up for Youth or ICTSOS to get into the schools and start addressing this issue. And now that we're going to have more space and a better facility, we can finally do that and really make a long-term impact. So here's our request. I just wanted to emphasize again that what we do is part and parcel of this, at least in the history of what this its mission statement, what it's done in the past and what it's funded in the past. The county funds plenty of nonprofits, and nonprofits that are similar in mission to what we're doing, helping children, multidisciplinary organizations, And, you know, so we understand that there is a budget crisis. I'm not here to, you know, dispute numbers. We are requesting $100,000 this year and $1.2 million, which matches what the city gave us, over 5 years, and that can be extended. I understand that, you know, EMS and the Sheriff's Department and the DA's office had lots of conversations with Sheriff Easter and Mark Bennett about this. The last thing I want to do is, you know, take much needed funds away from them, but there's more in the county budget. So again, to emphasize how in line we are with what, it's hard for me to even imagine that the county wouldn't not contribute to the facility, this important. It's so in line with what I know is important, or at least shown that is important for this county. And like I said, there's so many private individuals, foundations in this community, the city, they're so invested in this issue. It's hard for me, and the fact that we are so intimately connected with the mental we meet monthly with the Wichita Area Sexual Assault Center, Step House. Like I said, that we are just very, and I'm very proud of that. So it may be irrelevant to this issue, but nonprofits in this community can be a dime a dozen, and they can get very siloed. I'm so grateful that we aren't reinventing a partnership with other nonprofits. And that I just, you know, finally, process and to saving lives. So somebody asked me the other day, they were doing a tour, actually, I think it was someone. So, what, I mean, we have better metrics. What we're looking at, he said, you know, what's success for you? And I said, success is no homicides, no one dying. Someone coming in here with a broken arm or a black eye, and then being able to leave here and feel safe. Have gone through the prosecution process, dealt with their any mental health issues, and, you know, address what it's like to have a budget and a job, pay bills, think about retirement. To us, that's success, but at base level, it is keeping people alive. Sheriff's Department bringing us people and keeping them alive. So I'm really, really grateful for the time. Thank you.
Thank you, Amanda, I appreciate it. Do we have questions from the commissioners? Any questions at this time?
I have a question.
Oh, Commissioner Cruz.
I have a question.
Yes, Commissioner Cruz.
Amanda, what was your exact ask? Are you asking for a certain amount?
So our total ask is $1.2 million over 5 years. We recognize, although I'm not intimate with the details, that there are severe budget constraints this year, and so our ask is $100,000 for this year with a pledge going forward. And I'm ready to sit down and talk about those numbers.
Okay, thanks so much.
Okay. Any other questions? One quick question. The city, did that come out of ARPA funds, or where did they come?
It was CARES funds.
It was CARES funds.
Yeah.
But you're asking for general funds from us.
I'm asking for whatever funds that I trust you guys with the budget and the money, and I understand that it's very complicated right now given the ARPA funds and so in conversations with, you know, for you to how the best way is to allocate that. I understand you need the ARPA funds as much as you need.
Commissioner Mike.
Amanda, thanks for the presentation. Appreciate it. Thanks for being here. We have this other group that we funded called Recovery Connect, and they connect to 20 federal programs if you're eligible. Have you talked to the Recovery Connect people?
We have started those conversations.
Okay.
Yeah, so we're talking with them. We're trying to figure out how
you fit.
Connect.
Yeah. And they may come back and say, hey, you don't have there's no venue, but, do you have grant writers in your staff? A grant writer? I'm sorry?
Yeah, I'm the grant writer. We're very thinly staffed.
Because Recovery Connect does not write the grant for you, but they could open the door or help.
That's great. I'm happy to do all
I would
that.
really encourage you to have somebody talk to them. I can't
I know
remember what
we've
her
had
name is.
conversations with them, and I just need to go back and,
They analyze your business and your, you know, for-profit, nonprofit, individual, whatever, and look at your mission and see if there's a fit.
yeah, that's.
And there's a lot of programs,
Yeah.
federal and out
It
there.
would be nice to have someone do that legwork. I'm happy to write the grant, it's just going out there and.
Yeah,
like,
and that's what I think that's what they do. I've had some feedback from others that have gone there and said, that was really helpful. They showed me
That's great.
I don't wanna
Okay.
make joke of it, but there's a lot of programs out there. So, thank you.
Hey, I don't see any other questions then. Thank you, Amanda, for being
I have
here.
another question.
Commissioner Cruz? Commissioner Cruz?
Thank you. I know that this is awkward, so thank you for allowing me to speak. Lindsay, I'm looking at the comprehensive Sedgwick County ARPA spending plan that was handed out on July the 13th. And when will we be revisiting the $8.1 million of contingency that is left in that bucket?
So, can you hear me okay?
Yes.
Okay, so, we can look at that whenever the commission would prefer. At this point, we plan to do that on a quarterly basis. I think part of the concern right now is that by virtue of having this public discussion and that there are other nonprofits out there, like, that were able to receive funds through CARES, which Wichita Family Crisis Center went through, we would have to talk with, Widow Bryan's to see if, by virtue of having this public conversation today, if we've created any harm. From initial conversations, I believe that we have, but, we can certainly talk about that.
So how is
All of the
the
that
psych?
come here are gonna be included in ARPA funding?
If they have come and spoken on something like this, then potentially, yes. If they've
I
come
have
and
a
talked about it
follow-up.
like this, oh, go ahead, Commissioner.
My concern would be that we had this conversation around the psychiatry program that KU and pitched to us. When will that conversation be had again, and how is that different than this?
So I think we talked about it at the time that was the only medical school in the state of Kansas that could operate a psychiatry program, and so there is literally no other competitor for funds for a program like that. And when that will come back is, I think, at the behest of the commission. I think when we presented the ARPA spending plan on the 13th, it was approved, and I think the comment I heard at the time from the chairman, and I don't know that I heard from others, was we weren't ready to access that contingency yet.
Assuming that there's no competitor to what we do, we stand similar.
I think the complicating factor is that you guys did get money through CARES, through a program that was set up that benefited a lot of agencies, and that's where the question comes. Now, are we giving you special treatment by cutting those folks out? We just give to you directly.
So the nonprofits that regularly money from the county.
They are a part of the general fund budget, and that is, there are different rules for that than from ARPA.
And so, like I said, I'm here asking county funds. Like I said, I'm here,
Right.
if there's a contingency in the general.
Yes, there's significant contingency.
Okay, perfect, thank you.
So follow-up
Any other
question.
questions? Commissioner Cruz?
So understanding the intricacies of this and wanting to comply with all rules and regulations for ARPA funds, when will you be contacting Widow Bryan's to ensure that we can or cannot use this, knowing that they are one of the only domestic violence shelters in our community?
if I am directed
When will you
by the
be,
commission to do this,
asking,
I will be happy to do that.
is there a way that we
If the-
can have the
if I need to do
conversation? I'm sorry, I didn't hear you.
If the commission wants me to do that, I will.
So I'm a commissioner and I'm asking you to at least have a conversation
And
to
we
see
have,
if
and that's,
this is,
okay, I will ask.
I appreciate that. Thank you.
Other questions? Thank you, Amanda, appreciate you being here, and thank you for your patience this morning.
Oh, no, thank you. Thanks for listening to me twice.
Okay, next on our agenda is corrections.
Chris?
Thank you, Lori. Education here. I'm Chris Morales. I'm the Deputy Director for Corrections, and I'm filling in for our Director, Steve Stonehouse, this morning. We are here to give you an update on moving, and then I also want to talk just a little bit about our staffing. So on the first slide, this involves our lease at 3803 East Perry. We have two programs there, or two office suites there, and I've used some acronyms here, so I will make sure and we have our CJA division, which is Criminal Justice Alternatives, and that is our pretrial services and drug court program. And just around the corner, in a different office suite there, we have juvenile field services. Services location for youth, and then we also have our evening report center. So those are the two divisions or programs of corrections that I want to focus on first. We were notified by the landlord of that property where juvenile field services is that he would not be renewing our lease, and we would need to vacate that space by the end of this year, this calendar year. So what we plan to do is take our juvenile field services operation and move most of it to where criminal justice alternatives. In order to do that, we needed to look at all available space within the county and just within our programs as well to see what we could do for efficiencies. And so that's the plan we have before you today. It involves taking 45 staff and moving them into our current locations with the exception of a couple administrative staff that will be moving to our Valley Lodge. So that's the first spot here on our timeline. We have two staff moving to our Valley Lodge by the end of this week. And then probably mid-August, so here in another couple weeks, we're going to have 12 of our criminal justice alternative staff moving, and they will split up. 6 of them will go to our 905 North Main location, and 6 of them will go to 622 East. So to back up here, our 905 North Main is adult field services, and 622 is our adult residential work. So pretrial services going one location and drug another. Then in a couple additional weeks, so I'm going to say the first part of September, the rest of our CJA staff, which would be about 5, are going to move to 905 North Main. So we're hopeful that by the end of September, all of CJA will have vacated that space and it will allow us to move juvenile field. There are 18 juvenile field services staff that would be moving to that location, East Harry, and then the ERC or Evening Report Center staff will move to our juvenile residential. As you can see, we're moving in parts and pieces here. We have about 5 phases, but we really hope to get this done by the end of October. Of course, we've allowed a couple months for contingency on that. We're using existing furniture in our juvenile field services location, and then, of course, if we have any surplus, we will certainly offer that to other Sedgwick County. The important box here in the bottom right-hand corner is that eliminating this lease eliminates the expense from the general fund, which is $111,807. So that would be for 2023. With juvenile field services moving in there, they are 100%. Next, I want to talk about our long-term goals. So for adult service programs, we consider these moves to 905 North Main and 622 East Temporary. We would like to move our pretrial services and direct work program closer to the jail and closer to the courthouse. And so we are hopeful that if the district attorney's annex is available at that time, that those two programs could move into work. We are also hopeful to eventually locate our juvenile services programs closer to the juvenile complex and the juvenile court. So that would involve a CIP process for a juvenile service building at some point. And those juvenile programs would be juvenile residential facility, juvenile field services, home base, and our evening reporting. So this would be in the location where our juvenile residential facility is now, right next door to juvenile detention. All of our juvenile programs would then be in one. So before I move on to workforce strength, because I want to talk about our staffing just a bit, that ends our presentation on move plans. Do you have any questions?
Any questions?
I do. So I'm looking at the chart that you just showed a minute ago. That fourth step says you have staff moving to 3803 East Harry. Is that not the space we're trying to vacate? Go ahead.
It's CJA, Criminal Justice Alternatives. It's just right around the corner by the Sheriff's Office Offender Registration.
Okay.
So they're in the same building, they're just going to move to a different suite.
So where will the evening report and the juvenile field services be when we get done with all this move?
We get done with all the moves. Juvenile field services will still be at 3803 East Harry, just in a different office where Criminal Justice Alternatives is now. And our ERC, or Evening Report Center, will go to where our juvenile residential facility. We do not have clients.
But we do plan to reestablish that soon. So
Yes,
is there room for both?
Yes.
Okay. All right, thank you.
Thank you. Any other questions at this point? Okay.
Okay, just the last two slides here. I just wanted to give you an update on where we're at as far as our workforce strength. This will look very familiar to what we presented in our budget hearings back in May. Currently, we have 106 FTE vacancies within corrections. This is only 4 people different, or 4 more people than we had in May. When we presented this in May, we had most of our programs in red. We had 11 reds, 2 yellows, and 1 greens, and today we have the same thing. It's just shifted a little bit by program. So we're at a 67% workforce strength now. As far as recruitment, we have a full-time recruiter. She's done a really excellent job being visible. She's been out there to colleges, career fairs, military events, 58 in total since the beginning of the year. Our statistics on hiring, though, are focused on corrections officers, because those are still our hardest to fill positions. Since the beginning of the year, we've had 248 applications for. Out of those, we've been able to schedule 91 interviews. Out of those, we selected 71 to move forward, but we're only able to hire 35 corrections officers. So that's still a pretty big struggle for us to keep those positions still fine. Just if my math is correct here, out of 248 applications, we only hire 14.
Can you go into why that is?
Sure, there's a variety of reasons why, and we've been trying to track that. For example, out of the 91 that we schedule interviews, we seem to have more no-shows for interviews now than we've probably ever seen. People drop off at different points, like failing our criminal background checks. We've had a number of people fail drug screens. We've had a number that haven't completed their necessary paperwork to get fingerprinted and come back in. So those are a couple of the higher ones. There's other reasons too. They accept other job offers. We've had people scheduled to start and then not show up. Okay, so we're tracking those to try and see. But right now, the majority is failing a drug screen or failing up at criminal.
Okay. Other questions? Okay, thank you.
Thanks for your time.
Stephanie, you're on.
Morning, everyone. I'm Stephanie Birmingham, your COVID public officer. Wanted to bring you up to date. You may have heard some of this information, but I want to make sure everyone knows what's going on the COVID front. So last Thursday, the CDC did raise our Sedgwick County COVID community level to high. It is the first time we have been at this level since this new system was instituted in February. They base this on new case numbers, hospitalizations, and bed space in our hospital, so the capacity to treat those with COVID. As a result, they are asking everyone to mask indoors in public, and that's everyone, even those who have been vaccinated. I know a lot of people hate to hear this. We've gone several months not having to wear masks, but to give you some perspective why this is so important, let's look at what we're facing right now. According to our health department, in the week ending Saturday, I think that day should be the 23rd actually, we had 909 new cases. Compare that back to March, we were getting less than 100 per week of COVID. Our positive test rate is now at 17.5%. Combine that with a vaccination rate that is still not stellar. 54% of our residents are fully vaccinated, 67% nationally. It is true the current vaccine is not as effective. The subvariants, it just simply doesn't match up. But I will say this, and this is a big but, the vaccine is still very effective at preventing serious illness that could lead to hospitalization or death. So it is still very worthwhile to get that booster if you have not gotten it already or to get up to date. So if you are fully vaccinated, I know a lot of people may be thinking, why mask? Why do I need to? Well, again, these new subvariants, BA4 and BA5, are very contagious, more contagious than anything we've had up to date. So that means even people who are vaccinated or have had COVID, maybe you've had it once, twice, you still get it again, and take it from me, you can still get pretty sick. So, and we're already seeing a toll on workplaces. Again, if you think back to last winter when Omicron first came out, people were getting sick, missing a lot of work, businesses struggling just to stay in operation. So again, you may not get so sick that you have to worry about going to the hospital, but you can still get pretty sick and miss a lot of time at work and things that are important to you. So the protocol right now, the Sedgwick County Health Department is requiring all its employees and anyone coming into their buildings to mask up. There is no mandate right now for the county buildings. It's up to each department head to decide what's best for their situation. The city of Wichita just yesterday decided to require all of its employees, any vendors, any contractors coming indoors to wear a mask as well. Unclear yet what the schools are going to do. That's going to be a big issue in just a few weeks, so we'll keep you updated on that. I will just add the FDA is asking vaccine makers to come out with a new booster that is targeting the BA4 and BA5 variants, but again, that probably won't happen until fall, possibly October. So until then, we really need to wear masks, and I even brought a box if you want to take one back for your office. So, any questions?
Thanks, Stephanie. Any questions?
I have a few.
Yes, Commissioner Howell.
First question is, who in Wichita made the decision for a mandatory masking policy? I didn't see that on our city council meeting.
You know, I'm not sure exactly. I just read it on news briefings.
Go ahead.
I'm assuming that management at the city hall made that decision. I was asked that question yesterday, but I've not confirmed that with Mr. Lane.
Okay. Well, I would like to just clarify. I hope that the county commissioners get to make the policy choice for the county. So, should management want to do that here, I'd like to make sure we have a conversation amongst commissioners, we actually have a vote to do so. Okay.
I know the mayor is actually at home with COVID right now.
I understand.
I don't know that it was a city council vote or how that was reached.
Yeah. Okay. The next question is, we talked a little bit about hospitalization status, and I've not seen any data regarding hospitalization status. I know people who've had COVID, lots of people have had COVID in the last few weeks, and most of them have went and purchased antigen tests. That's how they know they had something. They're not really going to get the PCR test as much because antigen tests are very available, around $10 at most places, like Walmart, Walgreens, and places like that. So I don't think we actually have a good handle on exactly what the prevalence of COVID is. I know people who have felt sick who've had antigen tests that came back negative as well. So, at the end of the day, I don't think we actually know our status. But I think the one thing to track that is probably the most significant piece of data, and again, I don't have any data right now. What is the hospital status right now?
I had talked with both doctors, Antonios and Ebersol, on Monday, just to get their population of COVID patients. Via Christi was around 30, and I think Wesley was very similar, so 50 to 60 between the two systems. But it's up. Their point to me was it's up. They were in single digits with patients. They see the significant rise. But
What about ICU and death?
in ICU, well, I don't know about death, Commissioner, but in ICU, there was percentages, 10% of the population. So Via Christi, I think, had 2 or 3 in ICU. Wesley had 2 or 3. And I also asked of their patients who is vaccinated, who's not vaccinated. They're not tracking that any longer. So if we want this kind of data, again, we're going to have to...
I think we need that type of data. So again, as people are going into the hospitals, hospital systems, to track their vaccine status or their prior COVID infection status is a key piece of data. We need them to capture that data. It's important for the public to know. I can just tell you that I know lots of people who have had COVID in the last few weeks. Most of them have either been vaccinated, most of them have been vaccinated. Many of them have already had COVID before, and most of them, the symptoms of this illness are very, very mild. A few of them a little bit more severe. The ones that were more severe did not have COVID in the past. So I don't know what percent of the population has been vaccinated, fully vaccinated, vaccinated and boosted, or had COVID infection in the past. I think I saw a stat yesterday that I think it was 60 or 65% of the population has contracted COVID in the past. So for those folks, coming in contact with the BA4, BA5 virus is a reminder to you that this is still out there. Many people with a strong immune system, your body's reminded that this is out there, and I think your body reacts by saying, I'm going to create more antibodies, and I know it's out there. If you don't see it in a long time, I think it creates more vulnerability. So at the end of the day, I'm not as concerned about the BA4 and BA5 because I don't see the hospitalizations, I don't see the ICU beds, I don't see the deaths happening from this. And again, I think what the end game is that this is going to be out there. It's not going to go away, to quote Dr. Mins over and over again. It's not gone. It's just something we have to live with. So the question is, how do we live with it? We want to be in a perpetual society with masks and have a constant discussion about this. That's where this is leading. I think we need to talk about how do you live with COVID. It comes down to education and personal choice. And I really don't want to see a mandate from Sedgwick County. I think we need to be very, very careful about trying to protect someone from a virus, which I think it's not even possible to protect yourself from this virus. It's everywhere. The question is your immune system strong or is it weak? And if you've had the virus in the past or you've been vaccinated, then I think you're prepared, especially if your immune system is strong. I think that's the message: is let's be educated, make personal choices for your health, and understand it's out there. And if you do get sick, please stay home. Those are great messages. But the idea we're going to prevent people from coming in contact with this virus, it's just not possible. So I think we need to have a different strategy here. And I think if we're going to go down this path of trying to mandate mitigations for coming in contact with the virus, it's futile. We're not ever going to solve this problem with that method. So I'm very strongly opinionated here. I think having good data from the hospitals that talks about what type of infections they're having, what's the background of these patients without violating HIPAA, is key pieces of data. We have to have data to know what to do here. Again, if the hospitals are becoming overwhelmed, and we know it's people who have been vaccinated or had COVID in the past, then you got my attention. But until that happens, we need to be very careful about mandates from the government. I'll stand for questions as well. I think that's a bit of a speech, but I'm just very concerned about where this is going.
I just want to make sure that we're understanding that we have no comprehensive mandate from the county for masks.
We haven't had in the past, though.
Well, absolutely.
Right.
What we did when the Board of Health took that mandate away is we gave department directors, elected offices, appointed officials, and the judge the ability within their workshops that if they want employees to wear masks, they can ask. So that's the way it stands today. I want to make sure that the Board of Health is comfortable with that policy. For example, in corrections, I know that when all of a sudden they have a swelling of infections and they're losing workers right and left, that sometimes they'll put masks back on. I don't know if the election office has a similar thing going right now. But we have given them the latitude departmentally about a holistic order from the county. So I'm hoping that that is okay with the Board of Health to at least allow department heads to have that kind of discretion in their work. Not only for COVID, but for flus or any other kind of situation which cuts their workforce in half, that they have some ability to do some type of strategy to mitigate that.
So let me reiterate. I think the strategy you're describing is there's an assumption that the masks will protect you from COVID. I know Joe Biden has COVID right now. He has every precaution you could possibly imagine, including ensuring the people he's with have had all the protections as well. He's in a bubble, and he's still got COVID. At the end of the day, I think the idea that we can somehow avoid this virus with things like masks is right now doesn't seem possible. The BA4 and BA5 are so much more capable of getting to people, even in what we experienced in 2020 is not this virus. It's a different virus. And so, thankfully, here we are in 2022. We have the majority of the population has protections in place. Some people will come down with this sickness, and they'll have minor symptoms. Some people who've never had a shot, have never had COVID before, they are much more at risk of this virus. And again, but that's a very small part of the population. And they need to be very educated and take mitigations themselves. But the idea that we're going to mask society, at this point, it doesn't make sense to me. But we need, the strategy is this. Make sure your immune system is strong. And make sure you have protections in place. Make sure you understand how the virus is transmitted and take precautions on your own. But the idea that the government's going to somehow protect people with a policy, if we go in and start trying to, in any department, if they institute this mask mandate, it's almost misinformation to me. But you have to be very careful not to say that that's the right strategy. The right strategy is to say each person needs to understand this, make sure you have mitigations and have a strong immune system, get plenty of sleep, and when you feel sick, get tested and stay home. Those are the right strategies and the right messages. I think for us to pretend that masks are somehow going to stop this virus from getting around is just not realistic. I'm also very concerned. We have an election coming up. We have schools that are starting up, and misinformation right now is critical. I expect we will see some type of a booster in October, and that may be well and good. But we have an election right now. We have schools starting up, and the messages need to be spot on. And right now, I don't think the messages are correct that we can somehow avoid this. When you're around people, you're going to be around this virus. You go to church, you're going to be around this virus. If you're going to be shopping at a store, you're going to be around this virus. The only way to avoid this is to stay in your basement. And I don't think it's what people should do at this point. If they have protections, if they've taken measures if they understand what's going on, cautiously go out, be strong as you possibly can, be smart about this virus, and when you feel sick, get tested and stay home. But until then, please live your life. And for those out there that have more vulnerable status, take extra precautions. I think that's the right messages. But to do this at mass for all people in all places, it's not good strategy. It's not going to work. All right. Thank you for listening to me. I appreciate the chance to speak.
Thank you. I'm going to go to Commissioner Lopez, then Commissioner Cruz, and then I've got a couple questions. So, Commissioner Lopez.
Thank you. Well, first, I want to make sure that the headline is not going to be the Board of Health says masks don't work, because that's completely inaccurate. Nothing is perfect, but if you ask any medical professional, they're going to say you should wear a mask if you're in close contact with someone who's got this, or, medical professionals have been wearing masks throughout the test of time because they work. So let's just point that out, that the Board of Health is not, as a whole, saying masks do not work. But the other thing, I agree, if we're going to talk about personal responsibility, we need to make sure our community has the information that we have. So when we took the dashboard down months ago, we said if the numbers start to rise again, we would bring it back up so the community would be able to see, have a better idea of what's actually happening in our community as best that we can give that information. It's really hard for anybody to find that on their own right now. So I would suggest that we get the dashboard back up and just say, as numbers are increasing, here's our hospitalization rate, here's, what we're seeing right now, and then as that goes down, we can take it back down again. I agree this is not going to be going away anytime soon, so maybe we can put some parameters on once we see a certain threshold, it comes up, and then we don't have to have an argument about whether this is here or not, and then once it goes under whatever we want to set, then we can take it back down. But if we are going to lean on personal responsibility, which I'm going to imagine that's probably the case, just because even when we were at the height of this with over 30%, I mean, we didn't get a mask mandate. We're not discussing mask mandates right now, so I'm not sure why, we heard all of that about masks at this point, but if we are gonna say we need to be personally responsible for our own health, and we need to make sure people have access to the data, to be able to make those judgment calls, accurately for themselves.
Commissioner Cruz?
Thank you. I have to agree with Commissioner Lopez. I think it's important that we, first of all, know how many employees are out. Does anybody have that info? Like, how many employees at Sedgwick County government are out right now? I mean, I'm one of them, and I'm a pretty healthy person, and this really was not fun. I'm still getting over it. I mean, the body aches, the headaches, the intense coughing, it's not fun. And to know that our employees are out with this right now, means that services aren't being provided to our community. So who can tell me how many employees that are Sedgwick County associates are out right now with this?
I'm looking at Sheena. I don't think we have the number, Commissioner, on the number of employees. We could probably give you a number of employees out using sick leave, but as far as what that sickness is, I don't know that we can spell out how many have COVID.
I would also add that many employees still remote work, and so they could still be working and at home, and we wouldn't know that they have COVID either.
But those employees like 911 operators and our paramedics and EMTs and firefighters and those comm care employees who are, actively interfacing with the public on a daily basis, they're crucial to our operations. And so I'm wondering specifically in those departments, if we could follow back up once you guys have determined how many people are out. I think it's important to know the data around how many people are out. So yeah, I haven't heard anybody talk about mandating masks. So I'm not really sure, to Commissioner Lopez's point, why we're just jumping to that. The last thing that we did was we talked about recommending it. Whether that works or not, remains to be seen. But we do know that masks slow the transmission of this virus, and that is proven time and time again. And it's important that, we make sure as the Board of Health that we are following the science around trying to keep our community safe. So I'd like to have a follow-up with how many Sedgwick County employees are out specifically in those frontline facing departments, so that we can get an accurate picture, because our number one goal is to provide services to our community, and we can't do that if we don't have frontline professionals doing that service and that important work in our community. So when do you think that you could possibly get that information back? What's the appropriate time frame to collect that data that you feel you could produce those numbers?
Commissioner, we'll ask department heads today if they can assess numerically how many are out sick, and if they know how many have COVID, and we can spin that around relatively quickly. And then I think maybe it's a situation where we just get a weekly report from departments, those frontline departments. That's the only way I know how to, unless you can think of
Even if we pull sick leave, there's no way to define if it's COVID or not.
Well, then let's just figure out how many people are out sick. And because that's important to know, how many people are out sick. I know it's a wildly unpopular thing, but as the Board of Health, it's our responsibility to take the burden off of department heads when it comes to being the one saying we recommend masks. I mean, that's our job as the Board of Health. And I get it that it's election time, and I get it that we have lots of things in the works here, but I'm not going to skirt my responsibility just because I'm up for re-election. I think it's important for us to understand this is our job and we have to do it. And so that's where I stand on this. And I think it's important that even if we just recommend masks, we know that not everyone's going to follow that, but at least people will feel comfortable knowing that the Board of Health stepped up and said, we recommend that people We'll follow the science and what our health professionals are telling us to do. Thank you for the opportunity.
Thank you.
I was just going to add that Commissioner Howell mentioned about the at-home testing kits, and that is a concern as well, that we only have the confirmed tests with the positive testing rate at 17.5%, but we have to imagine that many people are testing at home. We ask them to report those positive tests, but I don't think most people do. So probably the positive test rate is much higher than we even know, and there's really no way to gauge, but I have to believe that 17.5% is just the confirmed positive test rate. It will be much higher.
Thank you. Well, I just got two questions. One, I know that Dillon's and Walgreens and those places are providing vaccines. What my question is who can go to the county to get the vaccine? Where do we go? What's it take? Can we get the word out on how that they can get the vaccine if they would rather go to the county to get the vaccine?
Sure. When COVID numbers were low, we did return to our core mission of vaccinating those who are uninsured or children through state programs like CHIP and CAN. But with the COVID numbers rising again, we did have a special clinic offering the tender age vaccinations, all the age ranges for anyone that came in. And I am told that is going to continue at the West Central Clinic. We will no longer just take those who are uninsured. We will take anyone who makes an appointment for a vaccination.
Okay, but it takes an appointment.
It does take an appointment.
And can we get that number out to the public so that they know how to call to make the appointment?
Sure. I believe it's 660-7300.
Okay. Second
We
question.
do not do the tender age vaccinations at our mobile clinics, but we do all the other vaccines for the different age ranges. So we have multiple mobile clinics as well, and all those locations are available on the health department website.
Second question is kind of related, same thing on testing. What are we doing county for testing? How do people get a PCR test today if they want a PCR test? I know you can go get the antigen test, but if you want to be sure whether you've got it and also that gets reported, how do we get a PCR test?
Again, the West Central Clinic is available. There are also many pharmacies that will do those tests as well. All of that information is on the health department website. There are many resources to get tested.
Okay, and we can send out part of our little press release that who they can call in order if they want to get tested and vaccine.
Sure.
Okay, Commissioner Howell.
Thank you. I'm just curious, the 17% that you referred to a minute ago, where is that data coming from?
Our epidemiologists.
So that's a Sedgwick County calculation
Yes,
based on health department tests that are being provided?
yes. I'm not an expert in how that all works, but I know they work with KDHE and the CDC to come to those numbers.
It's a KDHE number. It's the number of positive PCR tests that are reported by anyone who does that work. So
if you go to a doctor and you have a PCR test, that ends up in the report as well? Okay.
yeah.
Again, I think there's been a shift towards the antigen testing from the public. I know lots of people who've had antigen testing and have not gone and got the PCR. So there's a tremendous amount of antigen testing happening, and the people are paying for that test themselves, and the results are not being reported, right? So this 17% really is almost a misnomer. Let's talk about that. If someone feels like they have COVID and they go get tested, the surprising thing is that nearly 4 out of 5 people don't have COVID. That's interesting to me. They think they might have COVID, and that's why they're getting the test. Yet 4 out of 5 don't have COVID. So the word, 17% to me needs to be explained. I do think there's lots of COVID in the community, so I'm not going to debate that. But I don't know that I'm not sure that number really has a lot of meaning. Knowing how people are getting tested, that number does not have a lot of meaning like it used to back in 2020. Okay, I just think that you have to understand what that number means. I'm looking at this room right now. We have 13 people in this room that are not masked and 5 that are. If Sedgwick County is recommending masks, I find that interesting. And the reason I'm talking about this today is because Wichita just issued a mask mandate for their government offices. So it is a relevant discussion. I think we're going to be pressured this week to do the same thing here in Sedgwick County. And I guess I want to be very clear that I don't know that that's the right strategy. Right strategy is that everyone needs to understand their risks and be educated and make best decisions for themselves. And back to the point of masks, I don't know that a mask can necessarily keep you from contracting the BA4 and BA5 variant. It is so able to being transmitted from person to person, much more than anything else we've seen before. So again, the idea that you're going to somehow avoid the virus, I don't know is the best strategy. The best strategy is to be ready for it. And when you feel sick, please take precautions and do the right thing and stay home. But at the end of the day, yes, we're the Board of Health, and I do think masks may marginally they might reduce the transmission in some small way. But does it keep you from getting in contact with the virus? I don't think it does. There's people out there wearing masks and they're still getting sick. So we got to be very clear. What about bringing up the MDL? MDL, is it still able to do PCR testing? Why not get that refunded and get that started back up again?
It is.
Can our constituents go get a COVID test at the MDL and somehow the government's paying for that?
Yes.
Okay. I don't think I heard that a few minutes ago, so that needs to be clarified. That's all my questions for now. Thank you.
Okay. And speaking of the testing, we have capability in-house of running PCR tests. How many can we do a day?
Request to do more.
Okay, so we've got pretty good capacity here, but if we had to, we could possibly go back to the MDL. I don't even know if the MDL is open right now.
It is, and the public is able to access the MDL.
Very good. Any other?
It's also important to note, I wanted to touch on this about people getting tested, because as the variants have mutated, the symptoms now are much more cold-like. We're not seeing as many cases of losing sense of smell and taste. We're not seeing the severe fever that we did initially. So a lot of people may, in fact, think it's a cold, it's allergies. So we are encouraging people, if you do suddenly feel sick, maybe it is a cold, but go ahead and get tested, because then you'll know if you need to quarantine or isolate. So a lot of people may not be getting tested for that reason, because they think, it's just a cold, but you can't tell us this.
Any other questions? Don't see any. Thanks, Stephanie.
You're welcome.
Manager, anything else need to come for the staff meeting today?
I just want to make one quick request. We do have a standing budget agenda item on the agenda now. And I had sent a note asking if there's any way possible to get some of your, maybe your more complex, by mid-Tuesday afternoon, so that we have time to give you good information. So reiterate that request, please.
Good, thank you. And I followed up with an email asking everyone to make sure that you, let you know, because if we get to that point and you don't know ahead of time, why, I will probably skip it on the agenda. Okay, anything else? Yeah. Commissioner Howe.
So I'm not sure when I got this, but a few weeks ago, or maybe a week or two ago, I received a policy draft. We've not adopted yet, but I think it's incredibly important for considering today's staff meeting. We're being requested to provide $1.3 million to a outside nonprofit. The policy statement, I think, is very well written in this document. Are we planning to have a staff discussion about this, and are we planning to put this on the agenda to adopt? I don't agree with the entire policy as written. I'd like to see some changes made. But I think the main part of this talks about a budget process and of course, emergent funding out of budget cycle, which again is what this is. She's advocating for $100,000 in 2022. And let's just say the manager's recommended budget for 2023 is already in print. And so the $240,000 that she would want for 2023 actually missed the budget deadline for next year's consideration to follow this process. So I think we need to talk about, are we going to be adopting this sometime soon? Because I think the public would like to have some guardrails to know how to navigate essentially these requests through the county.
So, Commissioner, the plan was to, I have weekly meetings with you this week, and that's on my list of topics to talk with each commissioner one-on-one about, to get into it and any potential modification. After I visit with all commissioners and I feel like it's closer to final form, I think we bring it back and staff it and we talk about it in public. And then once we've had staffed it and heard from all commissioners publicly, we formulate it into policy, format, bring it back, and you guys would vote on it just like you do other. So 3 steps, but could happen as fast as what to happen.
From my perspective, I would like to see this worked out before we do anything else on the WFCC. Let's deal with this first, because I think this is an overarching policy. It needs to be figured out before we consider something of that magnitude, in my opinion. All right, thank you.
Okay.
I don't have any, I mean, I think we need to look at this too. I think it's just to have a streamlined process for people to know how to come to us and realistically ask for something. I don't necessarily think it's appropriate to say, to hold a policy that's not even worked through over any organization who's come and asked for money at this point. So, I do think we need to look at that, and then we can figure out what that would look like with the assets currently in place or not. But I just want to make sure that we're not holding a policy that doesn't exist over the organization's heads because they came in and asked for money before it was done, so.
Well, I believe that this policy is long overdue. There's some things in it that I don't agree with, but there are a lot of things in it that I do agree with. So I think we do need to push this policy through so that people know what to expect if they have requests. And right now, they don't know what to expect. And now we're putting our staff in with all the other things that they've got to do, trying to go through and analyze each one of these requests. I just had a Zoom meeting yesterday asking for $350,000 from another organization. So they continue to come. And of course, the more that we continue to give to this nonprofit and that nonprofit and this other nonprofit, everybody's going to say, wow, we've got a sugar daddy up here at Douglas and Broadway. Let's come on up, because they're just handing out money. Anything else need to come before the board? Seeing nothing, we're adjourned.